Okay, so here I'm skipping on to lab 3. So here, let's try to see if we can find all the nerves. So here, this would be the olfactory bulb, and then here's your olfactory nerve here, coming out, okay? And then here, we have the optic chiasm, so we know this is the optic nerve. So olfactory, and then the optic. And then if we look in here, so you would have 3 coming out. So you see it has the number 3. Why? Because it's coming out through the interpendicular fossa. So this middle part here would be the interpendicular fossa. So it would be coming out, right? And wrapping around here. And then you have your trochlear, right? So your trochlear is right here, but it's coming from the back. So remember, the trochlear is the only one that's going to be dorsal. So if they happen to kind of give you just a section, let's say they're just to give you this section here, right? They're only to give you this, and they're to go to the dorsal part of it, the back, you're going to be seeing it come out through the back, okay? So the trochlear nerve is going to come out through the dorsal part of the brainstem and then come out through here, right to the front, and wrap around the pons. And then you have your trigeminal, which is right here, so it's coming off the pons, right? So that's why it's coming off there, and it's a big thick one here, okay? Then you have your abducens, right? The abducens coming off from the very middle. So if you want to call it the pontomedullary junction here, right? Or the basis pontis part here, right? The bottom of the pontis. So you'll see it there. It's coming out from there. So 6, and then you'll have 7 and 8 is showing here, right? 7 and 8. 7, 8 right here. Okay. So I think I don't know what it was, but they were saying something about how to remember the cranial nerves that are coming off the pons. You would say 5, 6, 7, 8, right? And then pons. Just kind of a little trick to remember them. Okay, so again, cranial nerves on the pons, 5, 6, 7, and then 8 right there. Okay. And then we go down to 9. Okay, here's 9 right here. Right here on the lateral side of the medulla. So now we're in the medulla here. So now we know we're going down to the sides. So 9, and then 9 is a hypoglossal nerve. And then 10 would be the abducens. So I think she said you can either put the name or put the Roman numeral. So it's up to you. So 9 hypoglossal, 10 the vagus here on the side. And then you have 11 that's more medial here. So right here would be that accessory nerve. And then here on the very side, hypoglossal would be more medial. So here, so here's a hypoglossal, and then here's the accessory. So it says here the accessory because they come off the upper 5 cervical segments. So here, again, a glossopharyngeal, right, is the glossopharyngeal number 9, vagus nerve number 10, 11 is accessory, and then most medial is going to be the hypoglossal. Okay. So to recap, olfactory nerve 1, optic nerve 2, ocular motor nerve 3 coming out from the interpendicular fossa, trochlear nerve 4 right here because it's coming out from the dorsal part and coming into the front, the pons. And then you have trigeminal nerve 5, abducens 6, facial nerve 7, vestibular cochlear 8. All right, so again, 5, 6, 7, 8 for the pons. And then you have glossopharyngeal 9, vagus 10, spinal accessory 11, and then hypoglossal 12. Okay, and these would be in the medulla here. So now here, going down to the fornix, right here's the fornix again, the pineal body. So the pineal body, I believe it will be this part here, right? I think below that is posterior commissure. I'm not too sure though. Okay, but again, we're looking at it, right? Here's the anterior part, posterior part. So that pineal body would be over here and right next to the splenium, right? So here is the pineal body, or pineal gland. And you have the hypothalamus again, right? So here's the mammillary bodies right here. Right, see the mammillary bodies again are anterior to that medulla, right? And then here you would have an infundibulum that connects to there, right? I think, all right, so let's go on this one instead. Okay. So on here, hypothalamus, this is the mammillary body, 24. And then here would be the infundibulum connecting to the pituitary gland, which is this part that comes off, right? So just know that that is what it is, pituitary gland. Okay, so here I'm going to kind of skip over because the thalamus would have all those pulvinar, mediogenicular nucleus, natrogenicular nucleus, but you can't see it on here. Here we can see the superior collicula. Here, right here. So 31 would be the colliculus, the colliculi, but here's the superior colliculi and here's the inferior colliculi. And again, it is posterior, right, to the medulla. Okay. And then the obex, right, which would be this vagotrigone where it kind of ends here on the fourth ventricle. You can't really see it, but I would say that this is the obex here where it ends. And then can't really see the sulcus, but we could probably put it together here. And so the dorsal medial sulcus right here, dorsal medial sulcus, right? And then the can't see the fasciculus cuneatus, right? Really. Then let's go to the ventral view now. Oh, the dorsal intermediate sulcus would be here on here, right? So you see on here, there's your dorsal intermediate sulcus. So it's going to be separating the pyramid and the olive here. Oh, I'm sorry, the dorsal intermediate sulcus, you can't see it here. It should be in the back, right? Okay, so here now we're in the ventral view. So ventral view, here's cerebral peduncles, 23. See that? These are cerebral peduncles. Check out this. Interpendicular fossa, where what nerve comes out? Cranial nerve 3 comes out through the interpendicular fossa, right? Basis pontis, so it would be right here. So at the basis you have 3 cranial nerves. Medial to lateral would be 6, 7, 8, right? The pyramids, so here are your pyramids here in the front, right? And the decussation, you'll see it kind of curves, has like this kind of curving like that on that side where it crosses over, right? Excuse me. Then you have the olives. So here 38, I would call it the olives, right? So right here, okay? And then the ventromedian fissure, which would be this right here in the middle, is the ventromedian fissure here. Okay. So the other ones, just kind of look into that midbrain section to see it. Now I'm going into the openings of the skull. So I'm gonna kind of do we're gonna look at it superiorly and then inferiorly. So kind of in case they give it to you either way, right? So if you go onto page, we'll just go for a minute. If you go onto page $4.99. There you'll have them there. Kind of follow along. So here, right here, right, is where you have your optic canals kind of coming through. I don't think you know those. So superior orbital fissure, right? Superior orbital fissure would be right here. This opening right here, right? So it'll be the largest one here. You'll see it. And so what cranial nerves go through there? You have three of them. No, four. You have four of them. My bad. So all the motor, the eye muscle nerves. So abduce. Let me go through the order. Ocular motor 3, trochlear 4, abducens 6, and then you have one trigeminal nerve. So the V1 trigeminal nerve go through here, which is the ophthalmic trigeminal nerve goes through here. Okay. And then here beneath it, right, would be the foramen rotundum. Foramen rotundum would be here. That is where V2 comes in, which is the mandibular part of the trigeminal nerve. I'm sorry, the maxillary nerve, which is 3, or the maxillary part of the trigeminal nerve. And then here in the foramen ovale, which is this big circle here, that is where you're going to have your foramen. That's where you're going to have your foramen ovale. Here's where you're going to have trigeminal 5. The trigeminal, but the V3 come in through here. This is the maxillary one that comes in through here. I'm sorry, the mandibular. So again, in here, right, all the ocular motor 3, 4, 6, ocular, trochlear, abducens, and you have V1, the trigeminal, V2, trigeminal, V3, trigeminal. V1 is ophthalmic, V2 is maxillary, V3 is mandibular. Okay. And then go on to, I think it has foramen lacerum. So the lacerum will be most medial here, right? So this would be the foramen lacerum here. And then your foramen spinosum would be the one at the bottom of ovale. So a way you can remember the superior orbital fissure, the foramen rotundum, and the foramen ovale is single room occupancy, SRO, right? Superior orbital fissure, foramen rotundum, and foramen ovale, SRO. And again, lacerum and spinosum here. Okay. So, and then you have your internal auditory meatus, to be this hole right here. So if we're looking at it from the outside, it would be right here, right, coming in through there. So in here, your internal auditory meatus, you have facial nerve, and you have the vestibulocochlear nerve. So you have facial nerve 7, vestibulocochlear 8, coming in through here. Okay, I'll be coming in through here, and this one here. And then here, your jugular foramen, right here. So you have 9, 10, 11 come through, right? So know that one here. Okay. Your internal jugular foramen, right here. 9, 10, and 11. So your glossopharyngeal 9. There's your vagus 10 nerve, and your spinal accessory 11 nerve. And then you have your hypoglossal canal, which would be here underneath that jugular foramen here. These holes right here would be where you have the hypoglossal come through. But they also say that the styloid mastoid foramen, so you'll see that more in the bottom. So we'll go on there for that one in a bit. All right, but the hypoglossal will be where your 12th cranial nerve goes through. All right, now let's look at the bottom part in case they show it to the bottom. So again, just orient yourself medial, right? So here you would see, here's a supraorbital fissure. Then you're kind of like, oh, okay. I know where I'm at now, right? So it's S, right here. See where it is, right? And underneath that one, right, you can't really see it, but it'll be coming out through here, right? But you'll have your foramen rotundum there, foramen rotundum. Then the foraminal valve you can't really see here. So here's a foraminal valve. So remember, there's where mandibular comes out here. The mandibular trigeminal nerve here, right? And then medial to that one, right, would be the lacerum here. See, here's the lacerum. Right, the lacerum, and then underneath that oval, that's where you have your spinosum. Right, so your spinosum right here. Okay, a little spinosum right there. Right. Again, and then remember your foramen. Where is it? Your internal auditory meatus right here. Right, so coming out through here to the ear, coming out through there. Right. That's where you have, again, 7 and 8, so facial and vestibular cochlear. And then your styloid mastoid foramen, which is here. So you see your styloid process right here, and then styloid mastoid foramen right there. It says here that facial nerve comes in through here, right? So I might ask here which nerve comes in through the styloid foramen. But I don't think they will ask second order questions, just be first, right? But here's the styloid, orient yourself to the styloid. And then here is the foramen underneath the styloid. Stylomastoid foramen. And then in here, in these two, right, you would have right here in the bottom, this is your jugular foramen here. See the jugular foramen? So here it is right there, right? So jugular foramen, you have 9, 10, and 11. So glossopharyngeal, vagus, and accessory nerve coming through there. And then your hypoglossal canal, right? Or here is that foramen, right? Or the hypoglossal canal is what they're calling it. So the hypoglossal canal will be coming in through here. Okay, right in through here. Again, orient yourself where you're at. Here, glossal canal, right? Lateral to the foramen magnum. Here it is in here, right? Here's where it would be. Coming in through here, or coming in through this side. Okay, and those are the foramens. Alright, so let's kind of use this here to go over the cerebellum. So now here I'm in lab 4.